Welcome to HIMSS TV. I'm Laura Lovett. I'm the managing editor at Moby Health News. Today we have with us Mike McSherry, who's the CEO of Xealth. Thanks so much for being here.
Hi, thanks for having me, Laura.
Let's start off by talking a little bit about COVID. Obviously changed the way we do healthcare in 2020 and beyond. What should we expect in the future? How has COVID changed the game plan long term?
Well, as all the references have pointed out, it's vastly accelerated the rise of digital health and technology and how healthcare is delivered in the US. It certainly exacerbated the inequalities of health, as well as, vastly accelerated the adoption of telehealth as sort of the new front door, a means of accessing care. And then on the back end of that telehealth is how care is delivered virtually and what can be done via remote tools and offerings and diagnostics that then facilitate better telehealth experiences and longitudinal patient care.
Yeah, let's talk a little bit about that access component of it. What can we do right now, or what do you see in the industry do to improve access to healthcare?
It used to be you would go face to face and see a doctor. And because of COVID, that was just put on, standstill. And so we saw a rise of, for example, maternity solutions. Let me back up. What Xealth does is it enables clinicians to prescribe digital tools for patients that then would engage them against a disease state or some remote patient monitoring or some facility to learn about something, before a visit type or procedure, and then subsequently monitor all of that activity. So we've integrated over 40 different tools, from articles, videos, apps such as diabetes management, behavioral health, maternity care, or remote monitoring of devices against glucometers or CPAP devices or platform kits, et cetera. So all of that can be put into a prescribing workflow. So what we saw, exacerbated was just, for example, maternity care. Used to be that the apps would be very educationally focused. Let's help the mom learn about her pregnancy journey. But then an otherwise healthy mom in times of COVID, why does she need to go face to face to see that doctor if she's feeling fine and the baby's health is maturing, or the fetus is maturing, per the plan? So then you bring in the scales, the blood pressures, the other tools that would then demonstrate the healthy mom through that journey. And you can do all that via telehealth because the clinician then has access to all the diagnostics. So we just saw, that's an example of maternity and bringing in the virtual tools that then provide greater access to care in a safe and convenient manner for everyone.
Yeah, and sort of going along with that access piece is, we're seeing a lot of health disparities in the world today. What do you think digital health can do to sort of close those disparities, maybe increase that access?
Well, some of access is just convenience, right? And it could be bus schedules or how to get to, facilities. It could be time of day or convenience, taking a day off work, et cetera. So telehealth potentially facilitates that. On the back end, the range of tools that can benefit better patient care are pretty expansive. And for example, we've done meal delivery services prescribed to patients. We've done e-commerce products to patients. We've done transportation rides for patients. So whatever the clinicians deem are important for patient care that can facilitate better care, better intervention, better monitoring, better access, we can put it into our prescribing workflows. So, take that meal delivery and expand that vision. Why couldn't you prescribe healthy meals that are delivered to patients' homes via the Krogers of the world, the Amazon Freshes of the world, or some other kind of local nutritional, kind of programs that benefit patient care? And we think we see a more expansive vision of interconnected care that plays a more whole life care, preventative services, as well as facilitating the access to social determinant, type services that benefit, improved patient care and outcomes, ideally.
Yeah, and one thing I did want to touch on before we close out is a little bit about the financial incentives for remote monitoring. What are we seeing in terms of ROI right now?
Yeah, so this is the tricky thing against providers. Our customers are hospital systems. Our software gets embedded into their clinical workflows in their software. And most hospital systems have been largely fee for service. They want that face-to-face volume because it generates the reimbursement codes and the revenue. So they have not had the incentives to do RPM against chronic care because who's paying for that? And so we've seen that accelerated against behavioral health. in the rise of digital care on those tools, and then remote monitoring against PHQ-9 scores and patients, depression and mental well-being screenings, et cetera, along those lines. So that's an area where we have seen providers go ahead of the reimbursement curve just because it's for the good of the community and exacerbated against this whole COVID, dynamic and the anxiety of the country over the last, several months, if not years. The other element to that is the providers have been shocked because of the lack of procedural volumes that they've had. So they're jealous of the payers capturing that first dollar and in the massive profit margins that the payers have been bringing to the table over this past year. So we've seen our provider customers want to adopt more capitation exposure, collect more first dollar, go more at risk. And then if they're going to take that risk, they need to manage the patient population better. And that RPM and the risk interventions that go alongside of the remote monitoring play a huge role in setting the providers up in the future to more effectively compete against payers and new entrants.
It's so fascinating looking at how this is all playing out right now and what we could possibly see in 2021. So thank you so much for coming on and chatting to me about it today.